Magnus group. Today's topic is insight on role of nutraceutical in diabetes mellitus and metabolic syndrome. Uh, this is the collaborative work done by the Maharishi Markandeya University, Ambala, Haryana, and Indore Institute of Pharmacy, Indore. This is the agenda of today's talk, that is abstract introduction, diabetes and nutraceuticals, classification of nutraceuticals, mode of action of nutraceuticals in diabetes management, formulation, conclusion, and references. This was our abstract or summary that metabolic syndrome is a proactive clinical entity that is characterized by several cardiometabolic risk aspects, including obesity, hypertension, insulin resistance, and this influence is associated with an augmented pair of type 2 diabetes and cardiovascular disease. And all know that it's a majority growing public health concern around the world, not in India, around the world. Diabetes is so much problematic, and this disease has a high rate of mortality and morbidity rate, and there are various long-term consequences are there, like various uh, adverse effect are there, and it's still a significant risk factor for cardiovascular disorders also, and oxidative stress and systemic inflammation may also play a vital role in pathogenesis of diabetes mellitus, metabolic syndrome, and their vascular complications such as subclinical low-grade inflammation, alteration, antioxidant status, and tenacious platelet activation. The severity clinically use nutraceutical. Now, this is the role of nutraceutical in diabetes, that several compounds are like flavonoids, antioxidant, vitamins, conjugated renonic acid, minerals, omega-3 fatty acid, alpha lipoic acid, dietary fibers, and phytoestrogens are useful in diabetes. And their major objective of this study is to acquire more information about the prevalence and factors that influence the usage of nutraceutical by diabetic patients, and importance of the nutraceutical in diabetes, as well as provide methodological agenda for the clinical research on nutraceuticals usage in the diabetes mellitus and metabolic syndrome. This is the uh, summary or abstract. Now, what is the introduction of talk? And this is all know that diabetes has two type 1 and type 2, and it is a complex and chronic illness associated with a state of high blood glucose level. All know that high blood glucose, the hyperglycemia, glucose level high in, and occurring from a deficiency in insulin secretion, insulin action on both. And what is the symptom? This is a simple term. All know that for diabetic condition may include high level of sugar in the blood. The blood will not enter in the cell, and it will occur the blood in the sugar, increase the level of sugar in blood. Unusual thirst are there. Frequent urination, extreme hunger and loss of weight, vision is blurred, nausea, vomiting, extreme weakness and tiredness, and irritability, mood changes also there. These are the simple symptoms. And what is the classification of diabetes? Is the major types of diabetes mellitus are insulin dependent diabetes mellitus, or non-insulin dependent diabetes mellitus, gestational diabetes also. Now, what is the difference between healthy and diabetes individuals? You can see the in this figure that the healthy individual, this is the pancreas, and they release the insulin, and it in on the cell. This is a glucose transporter and insulin receptor. When insulin bind, then glucose enter into the cell, uh, and it simply metabolize the cell in the presence of insulin in the healthy individuals. And in the diabetes, one patient, here you can see the figure that pancreatic insulin beta cell damage, insulin don't release, and in the cell, insulin receptor is there, and the glucose is uh, roaming out the cell, and it increases the level of blood. And this is type. And second, the insulin release for insulin from beta cell, and insulin receptor, it could not bind to in the insulin receptor, and the glucose also travel outside, and it increase the blood level. And various symptoms occur, like high level of sugar and extreme hunger, and this is the due to the, and this is not the insulin ins, uh, glucose don't enter into the cell, so the glucose level increase the blood. And what is the uh, diabetes and nutraceutical? In terms of diabetes, herbal medications like nutraceutical provide a more promising treatment option with fewer side effects. These are the more safe. And scientist that Stephen D. Fallis, founder and chairman of the Foundation for Innovation Medicine, Stanford, invented the phrase nutraceutical in 1989. This is history. By combining the word nutritional and pharmaceutical, it is very helpful in diabetes. A food or component of a food that offers medical or health advantage, such as the prevention and or treatment of illness, is referred to as a nutraceutical. This is the definition, that a food or component uh, that provide the health in the or treatment illness or diabetes or other condition. And the Greek physician and inventor Hippocrates once remarked that let food be your medicine. And Indian culture also, we believe the treatment on our kitchen in food, and their other ingredient which are useful in our varied disease. And focus on prevention is the guiding principle. These were given by the Hippocrates. Now next is the diabetes has been shown to be targeted by a number of nutraceutical used or in clinical practice, favorably modulating a number of biochemical and clinical endpoints. Many traditional medical system employs hypoglycemic medications to prevent, regulate, and cure diabetes mellitus. And in India or other countries also, this is very uh, famous. The medications are derived from the plant like Memorita cerencia and Nigella sativa and Cinnamon cassia. These plants extract have demonstrated clinically significant. Other plants also there that are useful in treatment of diabetes. These plants, and Karela, this is in Hindi, Memorita cerencia is the very famous, and these plant extract have demonstrated a clinically significant benefit in preserving health, lipid profile, and blood sugar level. The lipid profile, these are related with the sugar, blood sugar level, and these are very famous or very popular uh, to reduce this lipid profile or blood sugar level. Uh, Now the classification nutraceuticals, various nutraceutical are available that are useful in diabetes or other concern or other health issue. Functional food, that carotenoids, dietary fiber, phytochemicals, probiotics, herbs. These are available for the nutraceuticals, available for the probiotics like microorganisms such as lactobacillus or functional food, various carotenoid or dietary fibers we are using in India or other countries for the treatment of diabetes. Now various herbs are available. Now this is the herbs used in treatment of diabetes, like herbs and biological source, common name family, the Mavarada Chericia, Cinnamon Gynaecum, Allium sativum, that garlic, Syzygium cumini, Gymnemia sylvestris, Nigella sativa. These are using in our general life for the treatment of diabetes. These are herbs are using in various diabetes. These are decreasing. And also in these are the our kitchen. Also we are using these things, and for the treatment of or reduce the level of sugar in diabetes. Now, mechanism of action that various nutraceuticals are there. That is various uh, like on liver that glucose production did decrease the glucose production, and less glucose in blood will be there, and which increase in the diabetes. Then intestine glucose absorption is decrease, and pancreas insulin secretion increase, and this increase the insulin secretion and help in the diabetes. And adipose tissue that peripheral glucose uptake, more glucose leaves blood into tissue, and these all regulate the healthy blood glucose level, decrease the blood glucose level, which helps in the diabetes mellitus. And nutraceutical various organs are there: intestine, liver, pancreas, or adipose tissue. So these are the help in the diabetes. These herbs, various herbs we have studied, their nutraceutical help in the we can see from this figure that various nutraceutical how can work on various organs and regulate the health blood level. And now various marketed formulation are there. Some marketed anti-diabetic nutraceutical products are desired in following tables. That marketed formulation, like name of product, like Gemnemia, that the manufacturer is the Himalaya. It reinforce pancreatic function. It improve the pancreas function, which the beta cell of the pancreas is the insulin. Insulix, that God Veda is the manufacturer of this product, and maintain healthy blood sugar level. And glucocare Himalayas is the manufacturer of this, and regulate blood sugar level. uh, Various ingredients are there in Gymnemia or Insulex, or like herbal product or nutraceutical. Madhuhar anti-diabetic capsule are there. That Globus is the manufacturer of this, and manage healthy blood sugar level and improves the metabolism. Diaphragm juice, the Capiva, that maintain healthy blood sugar level, and Fanny Life, that Wonder Laboratories maintain a healthy blood sugar level, and various marketed formulation are available. Diabetic care, like Pure Nutrition Naturals are the manufacturer. It regulate blood sugar level, promote metabolism, enhance insulin function. So there are various market formulation are available in India and outside the India, and these are help in the improvement the blood glucose level, is to regulate this, and various complications of diabetes mellitus. Now this is the figure of this. We can see here the in this table. We can see the very the Himalaya product, Gymnemia, Insulex, the Himalaya product, that Madhuhar anti-diabetic capsule, diabetic care, Life, diaphragm juice. These are the from the herbs they can prepare and helpful in the diabetes mellitus. Now, what is the conclusion of the study? That currently more than 150 million people suffer with diabetes mellitus across the globe, which seems to reach 300 million by 2025. And this is a very drastic problem in future also. So we need a permanent solution of this. Uh, and the nutraceutical herbal product have some laser effects also. They are very helpful when consumed within the appropriate recommended dietary intake. Nutraceutical have been shown to have potent effect to maintain healthy blood glucose level. As I show the figure, that various liver, pancreatic, how they can improve, regulate cellular metabolism, and enhance insulin function. And it is advised to the agency, IDF and WHO, World Health Organization, International Diabetic Federation, to implement the use of nutraceuticals, herbal product, for the betterment of the society in terms of less economic burden and better health care. And the nutraceutical herbal product have the laser side effect. Now, these are the reference from which we have covered this collaborative work, and also published some publication reputed journal also. Uh, Thank you, and thank you to Rajat Goel, my collaborator, and Maharishi Markandeya University and Indore Institute of Pharmacy. Thank you so much, Magnus Group, for providing me this platform for the my talk. Thank you so much.